And thanks for staying with us. It's still the conversation, and on the segment we're focusing on a critical public health issue, providing accessible and sustainable sanitation in Lagos. But before we bring this back to Lagos, just this morning there was a report from the WHO, latest data showing that Nigeria currently leads Africa in reported diphtheria cases with 8,587 confirmed infections and 884 deaths between January 1 and November 2, 2025. Here in Lagos, poor hygiene, overcrowding and inadequate sanitation often create the conditions that allow such outbreaks to spread rapidly. Now, joining us this morning to have this conversation on providing accessible and sustainable sanitation here in Lagos is Senatorial Ojo Emmanuel. He is the Director, Environmental Health Services at Lagos State Ministry of Health. You're welcome, sir.
Thank you very much for having me.
Yes, sir. Now, this morning, let's start this way. What exactly does accessible and sustainable sanitation in Lagos, what does it mean?
Sanitation standard cannot be overstretched. Health of one man is seen as health of all. You see, most of our health challenges are preventable by simple sanitation, by living sanitarily in healthy condition. More than 75% of our health concerns are already solved. So if we have top-notch sanitation in Lagos State, as the current government is propelling through the team agenda, the current government does not joke with issue of sanitation. All hands are on deck. Each MDA sanitation in the states, ministries are having rules to play, and we are taking that conversation to the grassroots as well. If you live clean, we are sure you live healthy.
So how would you describe the sanitation in Lagos as at today?
Well, if you go around the country, you still agree that Lagos State is still like the most cleanest state in this country.
I'm not talking about just the city,
well,
the ones we apply. I'm talking about the ones that we don't usually see.
Wow. The coverage of Lagos State is almost everywhere. I am a sanitarian and environmental officer, and I could attest to it. I work at the Ministry of Health, even though, but I have my colleagues, bulk of environmental officers work in the grassroots, the local government. So this crusade is being taken to the nooks and crannies. Every part of the state is feeling the touch of the government's desires and directives on sanitation.
So nobody is left behind?
I'm very sure nobody will claim ignorance or they don't know about sanitation.
Okay. Let's look at some of the challenges that the government is facing in ensuring that, like you said, these initiatives are cascaded to the grassroots. So what are the challenges that the government are facing at the moment, and also on the part of the people to ensure that Lagos is truly a clean state?
Well, you see, we cannot but have few recalcitrant people. The crusade had been ongoing. It doesn't start today. So Lagos State does not take issue of sanitation lightly, even from in the 90s. You know, in previous time before the cancellation of the clean-up exercise sanitation, we do have it monthly. Even there was a time we are even having it twice in a month in Lagos State. We have national and we have state sanitation exercise. Before that clean-up exercise is being cancelled. But even as that is being cancelled, we now turn to day-to-day sanitation. So we have our officers everywhere that take the crusade of sanitation daily to every homes, to every part of the communities within the state. No place, no community is left untouched. So the strategy is there is a law to be enforced. There are things to be checked. A checklist coming to any premises or the community. The checklist, we tell the officers the level of their compliance with sanitation standard. And then in Lagos State, I'm aware, there is even reward for cleanest local government, cleanest wards, Although we have not seen cleaned houses, but I think that can even be introduced.
But some of these the officers,
yes, I am one of them.
He's one of them. They are the wole. Is it because he didn't come in his uniform? So I'm glad you mentioned homes now.
Yes.
So how much of this awareness and sensitization is taken to homes? But because I will tell you, I live in Lagos. I've never seen any health officer, official, even in my area, not even coming to knock on my door.
You see, the reason is this. During the working hour that the officers will be on duty,
I'll be here.
You will be here.
But so somebody will tell me.
Definitely, if you have complied, that's why you may not know. We are friends of the community. We are friends of the people.
Okay.
When you have issues, when there is any shortcomings that we may see them, that they would have called your attention. Probably if you have left your septic tank unattended to, you have left your dustbin unattended to, probably you may have reached home one day and meet an abatement notice that will call your attention.
Oh, okay.
So we have room to sanction those who did not comply. So they go, as the name implies, that is house-to-house inspection. That's one of the core competence duty of an environmental officer. Even as a trainee, one of the things you learn in the training colleges is how to inspect premises, identify hazard or nuisances, and provide solutions to them. One of our core duty is to be friends to the community, assist them to abate. Our inspection is usually corrective, but it may be punitive if you fail to comply. So the crusade is everywhere. Every home is being covered. But it's because probably you have a sense, or probably you take responsibility that you may not know. Our coverage is everywhere. There is no nook and cranny of the state that environmental officers does not reach daily and weekly. Okay,
so still talking about homes, you've mentioned septic. You made septic tank an example. What are the other things the health officials look out for?
It's beyond that. I just had that as an instance that this is one of those that is so glaring. If you call nuisance, well, in a simple term, let me just define a nuisance for a layman. Any act or omission. Act, that is what's supposed to do. Omission, what's supposed to do that you have not done.
That you neglected.
That you have neglected, that will have negative impact on earth. Those are nuisance. Leaving your septic tank, by right, you're supposed to attend to it once it's reaching a stage. And every other nuisance, whatever you think is having negative impact on you residing there or people in your neighborhood, we see them as nuisance. So we can even be officers of our own by following the simple definition I just gave us. In our home, let us see what are my responsibility. Common sense tells us we should keep our environment clean. If I did not do it right, that's become a nuisance. Common sense tells us whatever you do in your premises should not affect others. Even your smoke, noise, those are nuisances. So we don't take them, we don't tolerate any.
It's not my fault that there's no light and I have to put on my generator.
No, well, we can't blame anybody for putting on generator, but nevertheless, your responsibility is to make sure it is in good shape.
It's in good shape,
Emitting smoke or giving unnecessary noises can be your fault. It can be your fault. So we don't just bring people to
people's homes.
We don't visit people home to punish them. We come to support them, to identify things that may be hazardous to them or their neighborhood, and even still assist them. Tell them the best way out to get it abated and resolved. That's one of our core duty of an environmental officers.
Let's also talk about sanitation in the marketplace. I know every Thursday they usually have the cleanup on Thursdays. How effective has that been? Even
aside from the Thursday, it's an agreement that the marketers prefer Thursday, as probably everybody want to come together to do it together. That is, we see that Thursday. Apart from the Thursday, market sanitation is one of the core functions of environmental officer to ensure that the market environment, both inside and outside, including their waste, are packed in a way that will not lead to public nuisance. You see, if we live right, the burden of diseases and illnesses will be drastically reduced. Most often, even things we buy from the market may even be the source of worries if the place where we are buying them is not sanitarily all right. So that's one of the reasons why officers of the local government will visit all the markets to see that the goods they want to sell might be fine. The food might be all right, but how about where they want to sell them? So that's why they go there to support them, to make sure the marketplaces, the surrounding, including their drainages, even we see to the even pests in the markets. You see, we talk about burden of illnesses and diseases. You know, some disease they call Lassa is correlated with rodents. If rats are eating things they want to sell to us, we may not know. So those are one of the duties of environmental officer, to be sure that both our market and things we buy there are of good standards.
Okay. Go. Okay. I like the fact that you're using the word support. You are very intentional about that word. So let's talk about public toilets in Lagos. What are the measures that have been put in place to ensure maintenance and also ensure that no community is left out?
We say public toilets is only for probably commercial places out of our homes. I don't think it's not right for residents, even in their homes, to still rely on public toilets for their usage. Public toilet might be probably, I am on the road, I'm pressed, I want to use myself. That's going to visit public toilet. We have series of public toilets. There are some informed that are built by the government. They have some that are built by private practitioners. They call it PPP. Some build, operate, and then transfer. So there are public toilets that are spread across the state. In public places, take a stretch of any long street in Lagos State. There is hardly a long street of up to 500 meters, you won't see about 1 or 2 public toilets. Even apart from the conventional public toilets, all commercial supermarkets, filling stations are compelled by law to have 1 or 2 toilets for public usage. Not necessarily their staff, nor even their customers for passerby, to make sure sanitation in Lagos State is in top notch. Okay,
so but why does open defecation persist in Lagos State?
It is, you see,
there are so many public toilets like you have identified.
Most of those places where you see open defecation are in suburb or in boundaries with neighboring states. If you are conversant with Berger, you see a lot of open defecation around that area. Yeah. I'm very sure if you are conversant with Ikeja, Agege, or in the main Lagos, you rarely find open defecation anywhere. Okay. So we don't know what neighboring states are doing on that, but Lagos does not tolerate it at all. Okay. Then the eradication of open defecation had been the policy of Lagos for up to about more than 10 years back or 15 years. True. Yeah. And even local communities have been supported. I was part of the crusade to Badagry and somewhere at Ibejuleki that the state government sent officers to go and support the communities, to assist them, to see how they can have their own communal toilet facilities to stop this open defecation. Most of the places where we are seeing them, probably at Songo, Berger, they are not part of our coverage. So most places are not part of our land.
Also, I observed that dump sites is usually an avenue for open defecation. And there's this particular area also when you're coming from the island and you want to link Igomo. That's that place called. You don't know? No.
Under the bridge. Yes. Let's I add to it. Yes. Let's add to that. Most often as well, where we have these our brothers from the north, most of them, even if you have toilets, if you see the concentration of those people in that area are mostly those are brothers from the north. Some of them are, I don't know, they sleep where they found themselves. And then most of them find it difficult to even pay the token, probably as small as 50 naira, even 100 naira in some instances to use the public toilet. At that Igamu you are talking about, as certain as an instance, I'm very much aware there are more than 2 public toilets I know personally, apart from the ones I don't know. Even some people even use mobile public toilet around that area. This plastic toilets, you see those like houses. You see it under that bridge. If you see that Igamubi, you see find some, apart from the permanent public toilets around that area, but most of those people probably because of poverty or less enlightenment. But we are doing a lot on it. I'm very much aware some months back, not up to 3 months, a lot of people are apprehended and paraded before the court for such offences at a special offences court. The officers of the state are working on that as well, but you know the crusade may not. Most of those people are not people who have good grip of what we're talking about, and I don't even see them as residents of Lagos. Most of them were transported with goods
okay,
to Lagos.
This brings me to my next question of rapid population growth.
Urbanization
in Lagos. How does it affect environmental health enforcement here now?
It is seriously overstretching. By right, an environmental officer should monitor a population of less than 8,000 by WHO standard.
And we're talking
but
about
if you
a population of over 20 million.
We are talking about over 20 million, and the last count I'm very much aware, the number of environmental officers in Lagos is grossly below 1,000.
Below 1,000.
Below 1,000. Okay. You could see we could not meet up with the requirements, so we have to overstretch ourselves. Okay. Some of us are doing what 2, 3, 4 persons supposed to do are together. Even in some instances, as directors still go out for inspection.
People like you.
I still go out for inspection because when there is no enough manpower to have adequate coverage, we still go out for inspection. And I didn't mean we have enough officers. My duty should be limited to administrative jobs. But when there is no enough manpower, but Lagos State is still trying. We still have some officers that we can still boast of. But it's only that, everybody see Lagos as the center where they can make their living. The last count we are calling 20 million. If another count is made within the next 3 days, you see that average of more than 5,000 persons must have joined Lagos population again. It's everyday Lagos population is increasing and we can't stop it. That's the problem of urbanization. That's the problem with other states. If they are proactive like Lagos, if the economy well-being like Lagos, I think the population of Lagos will balance. But everybody wants to run to Lagos from the other 35 states. Everybody see Lagos as their haven where they can make their living.
All right, I want us to talk about the existing sanitation laws here in Lagos. How effective do you think they are?
As I'm talking to you, in the Ministry of Health, we even have some people we charge to the court on the premise of that law. We have several laws on sanitation. Above one of them is public health law.
Public health?
Lagos State Public Health Law. That law was promulgated in 2016. Okay. It's a law that addresses holistically a lot of things that borders on environmental. Okay. And we have another law that covers all environmental laws. That's a 2017 law, if I'm not mistaken. It should be 2017. It's a combination of laws from LOMA, LASEPA law, LASPA, and all those laws that guide the environment. All those laws are effective. They are very, very effective, and we are applying them well.
Okay, you talked about applying the law now, and you have to sanction people. Exactly, who are those people that have ever been sanctioned? What did they do?
Examples. What they've done.
It may not be right to divulge identity of
not the identity.
People
crime.
It ranges from open defecation to urinating in open places, not even in homes, overfilled septic tank, in some places dumping of refuse. Even in my area, some people are apprehended for dumping refuse on the road media because they don't want to pay LOMA bill. So we apprehend those people and we take them to court. And several other nuisance so even structural nuisance. There are some distressed building people still residing. There are some premises that we are talking about that maybe the septic, their toilet is faulty. No, they don't even have. And people still reside in such places. So we don't take it with levity. We used to let them know that there are some Sharia in law. We have the backing of the government. There is law to be enforced, which we enforce 24/7. We don't joke with it. And we are making progress day by day.
Aside visiting residential homes, do you also visit offices?
For sure. You see, we have a segregation of job. I was a product of local government. I worked at the local government for up to 20 years before being transferred to the ministry. So the way we have it is local government monitor the houses, while the Ministry of Health, Ministry of the Environment, we concentrate on commercial places, companies, industries, offices. And that's how we have been working synergistically together. So the local government, the environmental officer at the local government, their concentration is mostly in the homes within the local government at the grassroots. So others at the ministry see to the other places that they may not be able to cover.
I want to know, what are the things you look out for when you are visiting commercial centers?
They are diverse. What to look at there
depends on where depends on the commercial
nature of
let me cite
like
let me cite an eatery for instance. You see, one of the core competence and core duty of environmental health officers is food safety. We have to see to the food they want to offer for public sale. As we are talking to you, some people still use expired condiments. So the burden of
condiments.
Yes, expired this, expired that, spices, expired butter, expired this and that.
It's part of your responsibility is to go there and check.
That is one of our responsibility. That's one of our responsibility. So we see to the food they want to offer for public sale. We see to the environment and some other nuisances such as noise, pollution, even hazards. Ergonomy is part of nuisance. The way their staff have been to a company where the manager lock everywhere so that people won't steal his goods, so that and there is no access. It's a nuisance. So anywhere, because he want to guide his products, he lock everywhere, even the window, everything. Not that there is AC there. Not that they have air conditioner. We have to bring them to book and force them to do the needful. You see, we are not labor union, but we speak for workers wherever we go for companies. What they cannot say, we used to be their mouthpiece. We put ourselves in their shoe. We want to ensure that wherever everybody works, they are safe. You see, most often people may not be able to confront their employers, but we can talk for them. In some instances, in work environment conditions, some people might need some personal protective equipment. We force the owner or the employers to provide for them. So those are one of those things we look into in commercial places.
I like the fact that you were talking about you mentioned we.
It is not about me because I've seen it all. Because I've been at the local government for quite over 20 years.
Because I'm aware that health officers, they have like an association.
We do,
which is the Environmental Health Officers Association of Nigeria.
Yes,
so what type of collaboration, do you have with like agencies like LOMA, La CEPA, which you mentioned earlier, in order to have an environmentally safe space here in Lagos?
Some of our colleagues, some of our members work in those establishments you have just mentioned.
They work
in those establishments you have just mentioned.
Okay.
Some of them work at LOMA.
How? Doing what?
Doing their duty. You see, as an environmental officer, it's your ministry duty you perform there that are related to environmental health duty. Okay. Like I work in the Ministry of Health. My role there is to do environmental health officer job in the Ministry of Health. Okay. Some of my colleagues work at Ministry of the Environment. They do environmental officer jobs in the Ministry of the Environment. Okay. Some work at Safety Commission. Some work at Nigeria Railway Corporation. Some of us works at hospitals. So what they have to do there is to perform environmental health officers duty
in collaboration with the
other agencies. Okay. You can't work in silo. Okay. We work. We have synergy with everybody. Okay. So, apart from having synergy with them, some of us are even working there. Okay. That they perform part of their organizational responsibility in those establishments, MDs you just mentioned.
Okay, let's look at flooding in Lagos, which is an area we have to talk about, and blocked drainages. What is your role as an environmental health officer, with people, and do you sensitize them on blood drainages, where people, when the rain comes, that is when they will know that they have to pour their waste, waste in the drainages. Do you even arrest these people?
Do I even limit it to engage with them?
Okay.
Do I limit it to sensitize them? We engage with them.
Engage them, okay.
So apart from, we make them see reason why they should not do. So, and
some people can be
definitely. We have seen instances where people intentionally load their refuse into waterways, into drainages, and we usually arrest such people, except we don't see. If you could see them, we have information. So we have synergy with CDCs, CDAs, a good environmental officers. On entering any community, you must identify people that matters. Know the people, opinion leaders in that place. So be their friends. They will give you the information of who are doing things when you are not there. Apart from that, anywhere during the course of house-to-house inspection, I talked about the other time, we engage people, let them see reason. That's why I said our inspection is not punitive.
Okay.
It is, we support them to correct wrongs. It is on rare occasions when people want to feel recalcitrant, when they don't want to take responsibility, that we turn into punitive. The major intent for inspection is to correct, to support, to correct them, to assist them to correct their wrongs. So on flooding, it's one of the core competence of one of the areas environmental officers are supposed to guide jealously wherever they have their coverage. In the local government, I'm very much aware that the desilting of drainages are one of the duties of environmental officer, environmental health department in the local government. They work synergistically with the Office of Drainage Services in the Ministry of the Environment. So the local government monitor the tertiary drainages, in some instances, secondary drainages. But while the primary, the canals, the connectors are being worked upon by the Office of Drainage Services in the State Ministry of the Environment. So we work seriously on flooding. We enlighten people. We detest it with all seriousness. We treat it as a stiff offense, which we address with alacrity and good attention. We don't take it with levity. We don't take it. We don't joke with it. It's one of those things we detest when we go for premises inspection anywhere, even at the state level, not limited to the local government, to house to house. During the house to house, they take it as important. Likewise, at the state as well, we see it as one of the core competence, one of the core things we want to look at. Inspection, in any instance, start from your frontage. If I'm coming to your premises to inspect, I'm starting from your front, from the middle of the road. From the middle of the road, your drainage is part of it. How is the drainage? Is it well maintained?
There's some houses or there's some areas that still do not have drainages.
Yes, it is quite possible, probably because due to their road network. Yes, it is possible, but where flood mostly affect are where we have drainages that are blocked.
Because the water can't
flow. The waterways are the major source of flooding. Is there any part of Lagos that does not have drainage? I doubt if there's any major streets in Lagos that does not have any drainages. Where we are talking that we not have drainage, probably inside community, inside interlands. We may see one or two streets that does not have, one or two streets that are still developing, that are yet to be tarred, that may not have drainage. Lagos State standard, as the way since I've been in Lagos, I know there's never a road without drainage. There's no major road without drainage. Even local government roads, they will have drainage in them.
I want to talk about schools. I remember, I'm old school. When we were going to school in primary school, sometimes we go with brooms, sometimes we go with cutlass, we go with, sanitation was
one of us. It's in us then. It was in us. We take it with us. Yes, man, you are right.
So let's look at what sanitation health officers now are doing with schools and school children alike.
Even in the State Ministry of Health, we still have a school health services as a unit. And likewise in the local government, one of the coverage of environmental officers are the schools. We still inspect schools, to see. Then when we have programs, special programs, we do invite school children. You see, when you teach one such tender minds, the message goes far.
Yes.
Catch them young.
We catch them young. Even we have in schools, we have some schools we have sanitation club. Our president is having a program on that, which they have been propelling for years. I mean, Dr. Akinjeli go to schools, secondary and primary school. We have this catch them young. We have sanitation club in the schools where we teach them about sanitation, to take the crusade home, which I believe is working in them.
And the teachers, do you carry them along too?
We can't enter school without having the teachers' consent. It's not possible.
And the teachers,
the school authority are all involved. They are all involved. They are informed and involved in this.
All right, as we wrap up, I just want you to briefly educate or reorientate Lagosians on the safety environmental practices that we all must.
You see, if I want to say anything, it's just that health of each of us is in our hands. The way we live is the way we find ourselves. If we live sanitarily or okay, if our environment is clean enough, as I said the other time, more than 75% of our disease burden is already solved. A clean environment is an healthy environment. If we are clean, we are sure to be healthy wherever we find ourselves. That's the parting shot I think I want to.
A clean environment is a healthy environment. That is his parting shot. Thank you so much, Sanitarian Ojo Emmanuel,
Thank you very
for your
much
time on the conversation. He is the Director of Environmental Health Services, the Lagos State Ministry of Health, and we've been talking about providing accessible and sustainable sanitation in Lagos. The conversation continues shortly.